Hello, and welcome to the Healing Clinic FMCS 4th year training video. During this video, I'm going to provide a tutorial on eClinicalWorks, the electronic medical record system at FMCS. Before we dive into the tutorial, I want to emphasize the importance of creating high quality and comprehensive SOAP notes when you're at the Healing Clinic. As the 4th year medical student, you're the person who's primarily responsible for writing the patient's SOAP note, and so the onus is on you to make sure that your history of present illness is complete and comprehensive, and that your assessment and plan are well thought out and well written, and really include all of the information that someone would need to understand what occurred during that encounter. This is even more important because we're a student-run clinic, which by definition means we struggle a little bit with continuity of care. Chances are that if you see a patient at clinic tonight, 3 months from now for that patient's follow-up, another provider will be seeing that patient. And so it's super critical that that provider be able to refer back to your note and really have a good understanding of what happened during that clinic session. So please pay attention to quality and make sure that you're being comprehensive when you document your SOAP notes. Let's get started. Let's begin. Click on the eClinicalWorks icon on your desktop. Type in your username, password, and press log in. Okay. I agree. Okay. Now once we're logged in, click on the Healing Clinic GW icon on the left-hand side to look at our schedule. Scroll down to the 5 p.m. slot because that's when we schedule patients for. You'll see that we have 2 patients scheduled for today. To select a patient, double-click on him. Double-clicking brings up this dialog box. There are 3 things I want you to know about this dialog box. Number 1, visit status. This indicates whether a patient is HIV positive or O42. If they're red, they're HIV, and you can be a red follow-up appointment or a red new appointment, new physical. Or if the patient doesn't have HIV, they're yellow. So our patient is an HIV patient, and he or she is here for a follow-up appointment. Second, visit status. This says pending, which means that the patient has not been checked in yet. When the patient has been checked in, this is changed to green or arrived by the front desk. And that's how you can know when to go back to the waiting room and pick up your patient once it's green. The third thing I want you to know about is this button called Hub. Let's click Hub. It brings you to a central database with loads of information about the patient. This is also how you access the patient's progress note. Bang! Progress note comes up in the background. You click out of this dialog box, and there it is. The progress note is where you will write the SOAP note. But before we get into the details of the SOAP note, I want to review 3 steps that you'll probably take before seeing your patient and starting his or her SOAP note. Step number 1, you're going to want to look at the patient's last visit at clinic if they're a returning patient. The way you do that is by selecting this drop down here and searching for a V that looks like it's an old patient medical note. So this is a food bank note, this is a referral note. You can see there was a telephone encounter where he had something refilled. This note says lab review. It sounds like a clinical note, so let's click on it. And this format here shows that the note was reviewed and locked by the attending physician. That's why it looks different. But this is in fact his last clinical appointment. you can see that he was here for an HIV lab review. And if we scroll down to the assessments, we can see what his labs were at the last visit, and then here are his assessments and his treatment. He has diabetes. They started Novolog 70/30. He has erectile dysfunction. They continued his Viagra. Peripheral neuropathy. They started amitriptyline. And you get the picture. So looking at the most recent clinical note gives you an idea of what you'll have to follow up on during today's visit. So that's number one. Let's go back to today's note, and you do that by clicking on this drop down again and scrolling all the way up to the very first note, which is today's note. And that brings us back to our progress note. The second thing that you might consider doing before you see your patient is looking at his old labs. You do that by clicking here on the Labs tab, and a list of his old labs comes up. The most recent labs were drawn on December 5th, 2011, so a few months ago. To view this lab, urinalysis, you click on the paperclip, and it brings up a page that has the lab results. You can then exit out and look at the other lab results. Shows his white cell breakdown. Let's see, here we have a CMP, complete metabolic panel. Let's click on the paperclip. Come on, paperclip, open up. And we can see his complete metabolic panel results. So labs is number two. The third thing you might want to look at before you see your patient are any prior EKGs or imaging. You look at that stuff by clicking on the Patient Docs tab over here. On the left-hand side, there's a scroll bar. Scroll down to X-ray documents. And X-ray documents contain old imaging and old EKGs. So here you can see his old EKG. Also, conveniently, patient documents is also where prior outside records are stored. So it looks like he was at GW in October of 2010, and if we go to the next page, we can see that he was there for a urology appointment, so we can read this note. Now here we are back at the main progress note page. To briefly review, I just told you that there were 3 steps you might consider taking before beginning to see your patient. The first was looking at the old patient note, the most recent patient note, by clicking on this drop-down box right here. The second was reviewing old labs by clicking on the Labs tab. And the third was reviewing outside clinical notes and old EKGs and imaging by clicking on the Patient Docs tab. Now let's delve into writing the SOAP note. But before we do that, I want to quickly review how we got to this SOAP note page. So I'm going to take us back to the main Healing Clinic schedule. Here we have our 2 patients that are scheduled for today. I double-clicked on Patient Test. It brought me to this box. I clicked on Hub, and on the main patient hub I clicked Progress Note. And it brought me to today's progress note. Now, when you first bring the patient back to the exam room, the very first thing you do before even asking the patient about his chief complaint is record the patient's vitals. So when you sit down then to begin talking to the patient, as the 4th year medical student, before typing anything else, you should type in the vitals that you recorded. And you do that by scrolling down to the objective portion and clicking on vitals. Here today's date is highlighted, and you can input their temperature, their blood pressure, their heart rate, respiratory rate, and if you scroll down, there's a place for height, weight, and oxygen saturation, and you should fill those in too. You can press X and the information saves automatically. The reason it's important to record vitals first is because your attending physician will be reviewing the patient's note while you're in the room speaking with the patient, and it's important for the attending physician to have this knowledge on hand to get a sense of how the patient's doing. Then, as you sit down and begin speaking with the patient, as a fourth-year medical student, you can start to record the information from your encounter in this SOAP note. So the first thing you do is record the chief complaint. So you click on chief complaint, and here you click add. Chief complaint number 1 for this patient is he's here for a hypertension follow-up, routine hypertension follow-up. He might also have a second complaint of right arm pain. Once you've added as many chief complaints as you want, click X, and again it automatically saves and populates here. Next, you can begin to write the HPI, History of Present Illness. This brings up a screen like this. The easiest way of going about this is by just using this box to type your HPI. So you type it the way you normally do. 29-year-old female with a history of hypertension and HIV who presents for routine hypertension follow-up, patient also complaining of right arm pain. And then you can go on to continue the HPI. When you press X here, it populates automatically, and of course your HPI would be far more extensive than this one. This is very incomplete. And as I discussed at the beginning of the video, because we're a student-run clinic, it's super important that your HPI be very comprehensive and just like the greatest HPI you've ever written. Because future providers who see this patient will want to be able to refer back to your note and see that you've really documented the information very well so that they know what's going on with the patient. Next, current medications. You can see that the patient's taking Caflex and hydrochlorothiazide. And on the right-hand side here, you can also see that information. So let's talk a little bit about this panel on the right-hand side. This panel is a constant. It always stays the same with future patient notes. So we have a problem list here that says HIV and hypertension. If you were to start a new note 2 weeks from now, HIV and hypertension would still exist here, and so would these medications. So now let's go back here, click on current medication, and suppose the patient told you that her nephrologist had added lisinopril to her regimen. So you click add here, and we type in lisinopril into this box. It doesn't come up though because 1, I spelled it incorrectly, but 2, the type here is incorrect. You want it to be set on all Rx. And now lisinopril comes up, click 20 milligrams, OK. And here we see that it populates both here and on the right hand side. So it'll also be a part of all future notes. Scroll down and click on medical history. Here we can add the patient's medical history, hypertension, and then add again HIV. And here we can add the patient's allergies. So sulfa, drugs, and then be sure to include the type of reaction and the type. Click X and it populates automatically. Surgical history and hospitalization are the same. You click add and type those in. Family history is a little bit different. The family members are listed here. When you click once on status, it's alive, twice dead, 3 times unknown, 4 times blank again. So we'll click status once, alive, type in the date of birth here, 1944, type in the age, and then click notes, and you can type in what the patient has. Hypertension, MI, history, it occurred at age 42. Click OK. The mother's alive, you'll type in her date of birth and age, and she is healthy. So let's type that in. Now, for social history, these templates exist on the left-hand side. I find them kind of challenging to use, so I would recommend that you just type your social history into this box here, the way you normally would type a social history. So, patient is married and lives with husband in Southeast. She works as a banker. Then you can do tobacco, 1 pack per day, ethanol, illicit drugs, TB risk factors, and anything else that you would list here, seatbelts, and all that other information. Click X and it populates, and then we move on to the last part of the subjective, which is the review of systems. The review of systems is a place where you do need to use these templates that are on the left-hand side for billing and insurance reasons. So remember to select these system templates on the left-hand side. So let's start with dermatology. You select a system and you see -4 and +4. Those are the only areas that you need to think about. So -4. Click Notes, and the patient was negative for rashes, moles, and lumps. Click OK. And then click the space for positive. What was the patient positive for? Maybe hives. Click OK. If the patient wasn't positive for anything, you just leave that area blank. Same with negative. Then we click another system, ENT. Negative, again, you choose the things the patient was negative for, and positive. And you go through and do that with all of the systems that you asked about. And that's the subjective portion of the SOAP note. Now we'll continue on to the objective. We had already populated the vitals section. It was the first thing we did. Now it's time for us to record the examination. Click Examination. Don't click Physical Examination. So we'll record everything under Examination. Again, you have the option to use templates here. I think it's a good idea to just write your examination out. HENT, normocephalic atraumatic, extraocular movements intact. You can say no lymphadenopathy, and you'll talk about everything else. Cardiovascular, lungs, abdomen, and you'll populate this entire section with your physical exam. It all shows up under examination. Now, once you've done the subjective and the objective portions of the encounter, you leave the room and you begin presenting to your attending physician. Together with your attending physician, you come up with the assessments and the plan. Now let's start putting in assessments. There are 2 ways that you can enter assessments. The first is for old assessments that are here on the problem list. You can simply click this left pointing arrow and the assessments automatically populate. If you want to enter a new assessment, click the link, and here you can write in the new assessment. Suppose the patient had a history of hepatitis C that she had never told you about. So you click hepatitis C here, and it populates. Now suppose the patient also has left arm pain. You'll notice that if you type in arm pain, that's not going to come up because it's not sort of a technically correct term. So you're going to want to think of the correct term, and in this case, because it was muscular in origin, we'll type in myalgia. Select myalgia, and it comes in. Now if you want to make some notes about the myalgia, we'll click here, and you can type that it manifests as right arm pain, and click OK. Now, hepatitis C is a permanent problem, obviously, and so you might want to add it to the patient's, in fact, you should add it to the patient's problem list. So the way you do that is you put a check in the hepatitis C box, and then come over here to where it says problem list and click the arrow and click add. Now that we've done that, once we close out of the assessment tab, we'll see that hepatitis C has populated here, and now it will stay here for all future notes. Now let's go back to assessment. There's one thing that I want you to know, that I want you to keep in mind, and it relates to the new patient. So suppose you come into clinic and you're assigned a brand new patient. This patient has never been to FMCS before. In addition to any medical problems that they tell you about, you also need to document that this is the patient's first ever time here. And so you'll type in routine, and you'll click V70.0, routine medical exam. And that indicates that you did a full physical exam on the patient. So you type in routine when a patient presents for the first time and they're getting a full history and physical, or when a patient comes for their annual physical exam. And you can close out, and we'll see here that we now have all the assessments. Now let us order some laboratories. So we'll click on treatment here under plan, and the treatment box opens. The treatment box has a couple of things going on. At the top here we have the prescription part, which we're going to get to. And then here we have labs. For the most part we don't use these other two boxes. So under labs, click browse, and it brings you to this lab page. You'll notice that on the left hand side all of your assessments have populated. That's because for every lab you order you have to link it to an assessment. So if we hadn't put the assessments in, we would not be able to order any labs, which is why it's extremely important that you put assessments in before ordering labs, and actually also before ordering prescriptions, because those also have to be linked. So let's order labs for the myalgia first. Let's order an ESR. So when you're ordering labs, you always have to start with an L dash, and then you can put in the lab name. And ESR isn't coming up, so let's order a CBC. And there's a book in clinic that you can look at to find out how to code for ESR when that type of situation arises. So now we've put in a CBC and it's linked with myalgia. That's great. Let's also put in a strep test, and the myalgia is clicked, so we're linking that with myalgia too. Now let's unclick myalgia. Now I want to explain two specific scenarios to you with regard to labs. The first is when a new patient comes in. So when you're seeing a new patient and it's their very first time at FMCS, the labs you order are called new. So you want to click routine medical exam, because that's what you're going to link it with, and you type in new. And now you're going to order every single one of these labs for the new patient because it's FMCS protocol. So we'll start from the top. We'll click it. That's already in the list. Cholesterol. It's confirming that this page confirms that the cholesterol is linked to routine medical exam. We'll click OK. Complete metabolic panel. OK. Cytomegalovirus. OK. And you go through and you do that for each lab, and you link each of them to routine medical exam. So that's what you do for the new patient, and they all populate here. Now for every HIV patient who's coming in for their routine HIV follow-up, you type in routine, and these are the labs you order for the HIV patient. Now it's important to realize that this is a little bit confusing here, right? Because for the new patient, you type in new and you link it to routine medical exam, but for the HIV patient, you type in routine. So HIV routine, and then you click all of these labs and link it to the HIV. So we click here, that's already selected. Click here on lymphocyte, make sure it's linked with HIV, click OK. And then you go through and you do that for each of these labs. Now for HIV, for routine HIV follow-ups, in addition to typing in routine and ordering all of these labs, you also have to order another lab that is L-RNA. And obviously that's very important, right? Because RNA gives you your viral load for the HIV disease. And so don't forget to do routine and L-RNA for HIV patients. So we'll do that, press OK. And then we'll exit out of here, save changes. And you'll see here now that under treatment, your labs for each of your corresponding assessments have been ordered. Now that we have completed the labs, let us start prescriptions. So, let's click on treatment again. It brings us to this panel. This is the prescription part. Now, suppose you want to either refill, stop, or modify a current prescription. You click Current RX. Here you see that we have the current prescriptions on the right-hand side and the assessments on the left-hand side, similar to the setup for labs. Again, anything we do with the prescriptions here has to be linked to the appropriate assessment. Otherwise, we get into problems. So, let's say that we want to do some things with the hypertension medications. So we check hypertension and we decide we want to refill lisinopril. So we click R here, refill. And let's decide we want to stop the hydrochlorothiazide, so we click stop here, S. So you'll see here now that under hypertension we've refilled the lisinopril and we've stopped the hydrochlorothiazide. However, in refilling the lisinopril, you had decided that you wanted to increase the dosage of the lisinopril. So click OK down here, and it brings us back to this main screen. We click our assessment, hypertension, and here we have our medications again, and this is the page where we can modify our medications. So hydrochlorothiazide has been stopped, lisinopril we're refilling, so you can click anywhere on this lisinopril part to get to the modification menu. Here we change lisinopril to 40 milligrams. We confirm that it's a tablet, one tablet orally once a day, 30-day duration, so we're dispensing 30, refills 0. Apply. And now that's changed our strength to 40 milligrams. Now suppose that you want to start a new medication. You click Add. Again, this new medication that you add has to be linked to an assessment. So let's link it to myalgia. And let's start aspirin. So we typed in aspirin and we find it. And here we have 500 milligrams of aspirin. We click on it. And as you can see, under myalgia now here it says start aspirin 500 milligrams. However, we want to modify this so that he's taking it more than just twice a day. So we click OK here. Click on myalgia as the assessment. Click anywhere on the aspirin line. And instead of twice a day, we'll say every 6 hours. 30 days. So if he's taking it every 6 hours, he's taking one tablet every 6 hours. That's 4 tablets a day for 30 days. So we'll have to dispense 120. Refills 0. Apply. Now it's time to fax these prescriptions. So to fax, now it's time to print these prescriptions. So to print, you click here on this downward arrow next to print script, and you choose fax RX. Not print RX, choose fax RX. Fax RX shows this screen. You then click preview fax, and now you can click print. The advantage of choosing preview fax and doing it this way is that it's already been electronically signed by the medical director at FMCS, Dr. Jenkins, so our attending physician does not need to sign this prescription. Now that doesn't mean that our attending physician shouldn't be confirming this prescription and approving of it. You have to show this prescription to the attending physician and make sure that he or she is okay with it. But this allows us to sort of make the process a little bit easier for ourselves. So we can print, and we'll choose a printer that is within clinic. It's usually at the front desk. So that's how we go about ordering the prescriptions. So now we exit out of there, and you see that our treatment area has now been updated. It has the labs for our corresponding assessments, and it also has the medications that we're going to start for our corresponding assessments. So here, for example, under the assessment myalgia, we're starting aspirin, and to learn more about the myalgia, we've ordered a CBC and a strep. That doesn't really make sense, but these are just examples. So now, to finalize this note, we need to type out our plan, because you can sort of get an idea of what our plan is based on the labs and the medications we've ordered. But as students, we want to be the best students that we can possibly be. So we'll click on treatment again. Brings us back to the same page. And now for each assessment, we're going to type out the specific plan. So HIV, controlled. We'll put in the last CD4 count and the last HIV viral load. Here, I don't know, 4,000. Continue current medication regimen. And that's HIV. Now for hypertension, click the hypertension tab. Hypertension. Controlled. BP today was 120/80. Stop HCTZ. Increase lisinopril to 40 milligrams Q day. Continue diet and exercise, etc. And you want to make sure that your plan is obviously far more comprehensive than this plan I'm writing. And then the same thing for hepatitis C, for myalgia, and for routine medical exam. Then when you click X, you'll see that your treatment area has populated accordingly. So here under hypertension, after the labs and the treatments, there's a space where you've typed in hypertension, it's controlled, we stopped the HCTZ, we've increased the lisinopril, and that's just much easier on the eyes and much easier to read for whatever provider needs to read your note weeks or months from now. Now that you're done with the plan, there's one last step before the SOAP note's complete, and this step is super important. You need to click the HPI again, and at the bottom of the HPI, write your name, MS4, and the name of the MS1 you were working with, or MS2. Then copy this information and also include it at the bottom of your plan, so that in the future providers will know who was responsible for this note. So here under Others, which is the very last tab, paste this information. And now your name is in two parts of the note. This is important because all of us sign into eClinicalWorks using the same username and password, and so there's no way of figuring out who wrote the note unless you've documented that information. And that's it. Now you're finished with the SOAP note. At this point, we've gone over the most important parts of eClinicalWorks, but we obviously haven't covered everything. If you ever have any questions in the future, you can always refer back to this video, or we also have exam room team binders at FMCS that you can use. One piece of information that those exam room team binders contain, but that was not included in this video, is the referral process. So if, for example, you ever needed to refer your patient to a specialist like a cardiologist, pulmonologist, GI surgeon, or if you need to send your patient for imaging, MRI, X-ray, etc., for both of those things, you need to input a referral. Information on how to do that can be found in those exam room binders, or you can give the clinic manager details about that referral and the clinic manager can do it for you. Now, before I say goodbye to you, which I'm really sad to do, I want to give you a few tips to increase your efficiency at clinic. There are ways of outsourcing parts of your SOAP note. So, for example, when you're done with the history and physical exam and you exit the patient room, make your way over to the attending to present to him or her, on the way to your attending, you can always stop by the clinic manager and say to the clinic manager, listen, things are kind of hectic right now. I haven't been able to do much of my note. It would be really helpful if you could input my assessments for me. And so you tell the clinic manager, this patient already has HIV and hypertension. Can you just put that into the assessment list? And they also have a new assessment of hepatitis C. Can you include that also? Then the clinic manager can access eClinicalWorks from a different computer, pull up your patient, and click on assessments and put those assessments in for you. That saves you a lot of time, because then when you're ready to put in labs and prescriptions, your assessments, which you have to link those labs and prescriptions to, are already in the system. Or alternatively, suppose your assessments have been put in by the clinic manager, and now you're talking to the attending physician. You're getting close to the end of your discussion with the attending, and the attending has confirmed that you need a certain set of labs. And so now what you can do is you can tell your clinic manager, when he or she pops his head into the room, you can tell your clinic manager, listen, I know that I need the following labs for my patient. My patient is an HIV patient, so I need the routine HIV labs. I also want an ESR and a strep test for this specific assessment. So can you input those labs for these specific assessments? And then the clinic manager again can go back to a different computer and input those labs for you while you're back in the patient room discussing things with the patient and getting the patient ready to go to lab. And that again saves you a lot of time and is super helpful. So I'd recommend using some of those tips to increase your efficiency at clinic. That's it for this video. Thank you very much for your time, and have a wonderful year at the Healing Clinic.